KEYNOTE-057 aimed to test pembrolizumab, which is a PD-1 antibody, in a specific population of patients with non-muscle invasive bladder cancer. And these are patients with high-risk disease that have received BCG in the past, which is an intravesical immunotherapy, and that are now considered unresponsive to BCG therapy. This population historically is actually treated with radical cystectomy, which means surgical removal of the bladder. And the reason we do this is because, unfortunately, BCG unresponsive disease, the natural history is to progress to muscle invasive and potentially metastatic disease. And radical cystectomy historically has been felt to be the only curative therapy for these patients. It's in this context that pembrolizumab was tested, hopefully as a means to achieve responses in the bladder and hopefully help patients preserve their bladders. Next steps for this trial are obviously to follow up these patients who have achieved a CR and truly see how long and durable these responses are. It's also worthy that this needs to be tested in a randomized setting, and that is what KEYNOTE-057 is aiming to do. It's the confirmatory phase 3 for this particular study. So while this study has the potential to have registrational implications for pembrolizumab in this population, the randomized phase 3 is also important as well. That will focus on patients with BCG refractory disease after induction BCG, and we'll be randomizing patients to either BCG reinduction alone or BCG reinduction along with pembrolizumab.